Hey everyone, so I just got done with my appointment. I did record the whole thing, but because of, I don't want to invade her privacy or anything, I'm not sure I'm going to upload that. But let me just whip this out because this is going to be the longest video ever. So after the visit, I went and I started shopping for some stuff today. So let me just show you what I got so far. This is not nearly, I'm not nearly done with my shopping stuff. And it's 97 degrees outside, so I'm wearing the smallest shirt I can find. So this is actually a tank top, just so you know, don't be gross. I got 2 bottles of hydrogen peroxide, 2 of them. And they were super cheap. I got the cheapest ones I could find. Why? Because it's the same stuff, and I work at a grocery store, so I know how the generic stuff works. It's just as good, trust me. I know. I work at a grocery store. It's okay. So I got 2 bottles of this. Oops, and there goes one. Hydrogen peroxide, family brand. Okay. Again, generic cough drops, cherry flavored. Oh yeah. I got me some wet wipes, antibiotic cream, triple. So the triple antibiotic cream I have is antibiotic plus pain relief. And I got this pill calendar, and it was like $1. I did get it all at a grocery store though, not the dollar store. This is just, and I'm gonna talk about this later, but all the medicines I have to take for 6 days. So this one works perfectly. I got some paper tape. I won't be using that though until after I'm a little more healed, and this is just to help flatten the scar. And I got some Dial hand soap, or just soap in general. I did get some Dial and bar soap form though, but I probably won't use it. It was just there, and I was like, oh, okay, might as well. Got this for like $1. Hand sanitizer, naturally. Again, the cheapest kind I could find because it's all the same. And so I got all that stuff today. By no means am I done. I'll do probably a final, I'm grabbing my papers. I'll do probably a final visit thing with my checklist of shopping stuff. So, and the lady who talked to me, I could tell she'd done it before because she was so fast in talking. She was she made all the major points. She just got to the point. So, my hair's all up. I'm about to go to the gym. My daughter's father just got her, so it's kind of like my night off. So I'm gonna go to the gym. So I'm not very graceful right now. And I got this list of the medications that I'll be getting for surgery. So I'm gonna go over that with you right now. So like I said, everything I take for 6 days, unless it's pain meds, then I can stop taking it whenever I want. So I'm going to take an antibiotic called K-Flex, and I'm going to start that the morning after surgery. And I'm going to take a steroid called, I have no idea how to pronounce it, but it's Medrol, and it comes in a pack. So let me just show you. Hold on, let me get my shiz ready for you. So this is the steroid I'm going to be taking. And that is for, hold on. The steroid, that one that I just showed you, is to help with swelling. The pain med I'm going to take, I got to choose between Percocet or Vicodin. Percocet doesn't affect me. I had that when I had my baby and I was torn and I had stitches and everything. So that didn't affect me at all. Ibuprofen, or no, Tylenol worked better than that for me. So I got Vicodin, and I don't want to be on that for more than 3 days. I want to kick my booty off of it. And for nausea, I don't know, I haven't seen any YouTube videos about this at all. but I'm gonna get a patch, and I have to put it on the night before surgery. So she told me it's a little patch, and it goes right here, and it helps with nausea, and I wear that throughout surgery, and I wear that for like as long as I want, and it releases medicine to help with nausea, and I've never heard of that before, so let me show you that one too. Is this one right here, the patch. So I'm gonna do that. My muscle relaxant is called Flexeril or whatever, and I start taking that anytime after surgery, but she said to just start taking everything the morning after. So that's going to be my muscle relaxer. That is it for that page. That's my medication. That's what I'm going to be taking. So I'll put that out of the way. And then I got a massive packet. Let me show you. It's pretty thick. Pretty decent sized. So I have to be there. This is my surgery date and the time. It's the 28th, and I have to be there at 6 o'clock in the morning. So I will probably be up at like 4, trying to like properly shower and clean everything, which I'll talk about a little bit later, because I'll talk to you about it later. So the first page is just table of contents, and the second page, drum roll, just kidding. Just kidding, it's the third page. So the first page, that's really like the third page, is called Healing of Body and Mind. And this is just pretty much like a letter from my plastic surgeon to the people, to his patients. And it's like, once you have the procedure you've waited for a long time for, you have to be patient and wait for your body to heal. And it's pretty much like you have to let your inner self heal too at the same time. And you have to take care of yourself because they're not going to do it for you. Essentially is what it says. So it's really nice. It's kind of touching. It's like, oh, we care about you. We're here for you. However, you have to do it your own self. Your own self. It's kind of my phrase for the week. I've been using that a lot. The next page is your anesthesia experience. And this, anytime you undergo anesthesia, your general health is to be considered. Then it goes on, blah, blah, blah. Don't do this. Don't do drugs. Make sure you have someone watching you for 24 hours after. Drink a lot of fluids. And it talks about that stuff again. I'm already at 7 minutes. Jeez. The next page is called Pre-Op Instructions/General. And it gives a list. 2 weeks prior to surgery, no aspirin, no ibuprofen, disclosure of all herbal medication, fish oil, and other things that fit under the herbal side. Discontinue all diet pills. I don't take diet pills and never will, so don't have to worry about it. No mass dosages of vitamin E. No smoking. You may take Tylenol. And it says start taking a multivitamin each day. And that's 2 weeks prior to surgery. You have to start doing that. And for me, I'm going to start taking my my stool softener this week. I'm going to get it probably on Thursday. I'm going to start taking it now because I told her I had a lot of trouble with my daughter after I had her being constipated. So she said just start taking it now. And then next list is called 1 week prior to surgery. Do not take any alcohol or drugs. Duh, you're about to be cut open. Now this is something I've noticed in some videos on YouTube. The doctor gives them a special like antibacterial soap to wash their body with, like the night before surgery or whatever. But my doctor just says use Dial for a whole week before surgery, which is different than what I've seen on YouTube. So I guess that's just something different. Report any signs of cold, infection, boil, or pustules before surgery. Do not take any cough medicines without permission. Cough or cold. Do arrange for someone to drive you. They say that a lot in here. Arrange for someone to watch you 24/7. The night before surgery and the morning of surgery. Do not eat or drink anything. So from starting at midnight, the night before surgery, I can't eat or drink anything. Don't sneak anything. No gum, candy, or mints, or coffee the morning of surgery. So nothing. Nada. No irregular medications. Take a shower thoroughly. Shampoo, no conditioner. This decreases no deodorant. So none of that stuff goes on your skin the morning of surgery because it decreases bacteria. So you shampoo the fudge out of your hair, wash your body, scrub it with the dial soap. No deodorant. Do not apply lotion, hairspray, powder, or deodorant. Brush your teeth, but do not drink anything. Do not wear contact lenses. So I will have my glasses on. Wear comfortable, loose-fitting clothes. And he suggested it be cotton, which makes sense. So I'm going to wear a t-shirt and some yoga pants. Don't bring any valuables. Have an adult drive you. Blah, blah, blah. Okay, pre-op shopping list. And so this is pretty much like a little checklist they just give you to check off. Prescriptions, Tylenol, multivitamin, dial or hand soap, or Lever 200, straws. It suggests you shrink from straws because you might not want to necessarily sit in the proper position to actually drink from a cup. Frozen peas, they're good for you and they are great ice packs, so they suggest 2 to 4 packages. Moisturizing ointment, Q-tip, hydrogen peroxide, gentle foods, and underneath it has a little list. Clear soda, not diet, so ginger ale, 7-Up or Sprite. Plain crackers, saltine but not buttery, so no Ritz crackers. Soup, water-based, not cream. Pudding or applesauce, Jell-O or toast. Sounds delicious, right guys? Pretty yummy. So, and then it goes on to give a huge list of things to avoid. And these are just all prescriptions. But like I said, I don't take any prescriptions, so that alleviates that problem right there. And so this next page too is like a whole bunch of other things to avoid, prescriptions to avoid, and I can read them off for you if you want me to. Just comment below if you want me to read it, and I will. But I'm not going to because don't feel it's necessary. Pre-operative instructions / general. Must have an adult drive you. Must have someone stay with you for 24 hours because of the anesthesia. Drink fluid, straws for the first few days after surgery. Bland foods for the first day or so. Avoid alcohol. Take the medications only prescribed. If you have an itch down in that area, don't itch it. You can expect moderate discomfort. Call blah blah blah. I can't tell you that number. Okay, call this number. I can't tell you the number because it's my doctor's direct line. Yeah, that's my brother. Keep the dressings clean. Do not remove them unless told to. After surgery, it's important you have a bowel movement within a day or two. Minimum activity for the first 48 hours. No cleaning, pulling, lifting, etc. You must be sitting at a 45-degree angle, so have a lot of pillows. It says in there, actually. You have to not have work for 10 days. They won't do the surgery. My doctor's office won't do the surgery on you if you have to go to work within 10 days. Once cleared to shower, you can. Do not use the bathtub for 2 weeks or until your drain is out. No smoking for 7 days. Cheating will delay your healing. You cannot drive for a while or until you're off pain meds. Do not use a hot tub for 4 weeks. This is for avoid sports or strenuous activity. You may return to work when you are cleared. Feel free to call when you need to, if you need to. Okay, and that's it. That's it for that. And this, yeah, that's it. It has a bunch of phone numbers for me to call, but that's it. So that's where I'm at right now. Okay guys, I will see you later. I hope you enjoyed this video, and if you have any questions, you can ask me, but I'll keep you updated. Of course, I love making videos, so I'll be here for you guys. Got heart to heart right now. Alright, I'm gonna go to the gym. Bye guys.